Hi.
Hi.
How are you?
Doing well. How are you doing?
Good. So, want to introduce yourself and tell us why you're here?
Yeah. I'm Kristine Burrows. I'm the Senior Specialist on Aging for the state of Colorado. And my role is to develop and implement our multi-sector plan on aging. Evan, tell us a little bit about you.
Yes, thanks. So, Evan Castor, I'm the Director of Homelessness Initiatives at the department. We both sit in the community partnership team, and our role is to really liaison, build out collaboration with external stakeholders. My role looking at housing and security across the department. So, tell us more why we're here.
Yeah, well, October 9th is Ageism Awareness Day, and October 10th is World Homelessness Day. And so we wanted to highlight some really cool cross-collaborative partnerships here at CDHS between aging and housing. So, Evan,
Yes.
from a housing system perspective, what does older adult housing insecurity look like? Is this a systemic failure? What's going on?
Yeah, so we are seeing a trend here in Colorado and actually nationally where older adults are not only growing the number of people, we're also seeing that housing insecurity, people who are on fixed income, it's harder and harder to keep up with those rising costs of rents. Housing has gone up, one of the highest, one of those social determinants of health that we see in communities. And we know that based on data from our national and our local partners, that 2.3 million older adults are experiencing worst case housing needs. That means they're severely cost burdened, spending more than 50% of their income on housing costs alone. It's really hard to keep up with those housing costs, especially if you're on fixed income, or it's really hard to change as wages have stagnated where housing has gone up. So, in response to that, from an aging perspective, can you tell us a little more what we're seeing in older adults in this crisis now, and what unique vulnerabilities do older adults face?
Yeah, that's a great question. And one of the things that the Colorado Coalition for the Homeless found was that the older adult cohort was the fastest growing cohort of people who are facing housing insecurity and homelessness.
Yeah.
And for reasons that you mentioned, thinking about fixed incomes, folks who maybe are on Social Securities or pensions or other retirement income that may not be keeping up with the rate of inflation or rate of cost of living. We also think about health decline and the cost of care needed to sustain our health span and our lifespan. Unfortunately, those costs are continuing to rise, and so is housing. And so we're seeing a significant increase in older adults who are facing housing insecurity.
Absolutely. And so tell us, what are we working on in Colorado? What are some of the strategies that we're trying to employ and those collaborations we're working on to really look at this crisis?
Well, as I mentioned, I am leading our work around our multi-sector plan on aging, and this is a 10-year blueprint to really identify how we can better create our infrastructure and support our infrastructure. And I think about infrastructure from a physical standpoint, but I also think about it from an economic standpoint, in a healthcare standpoint, and a social infrastructure to support us all as we age, because we are all aging one day at a time. And so one of our big priorities within our multi-sector plan on aging is our age-friendly communities goal. And within our age-friendly communities goal, we have this framework that we've built out to help communities better understand how age-friendly their communities are. So how is a community accessible for somebody who's 2 years old to 102 years old and beyond? In thinking about all sorts of domains. And so one of them, of course, is housing. And so we're thinking about safety and security. Do we have safe housing? We're thinking about zoning and land use. Do our zoning policies make sense for the housing that we need? Accessibility. We're thinking about universal design principles, especially in new housing models. Affordable housing and subsidies. Do we have access to affordable units? And then the idea of aging in place. A lot of folks want to age in their own homes. Do we have this continuity of care, this continuum of care that will support that? So I have a lot of big 30,000 foot view strategies that we're working on, but you have a lot more boots on the ground stuff. How's CDHS working with unhoused older adults and community-based organizations to decrease the number of older adults that are facing homelessness and housing insecurity?
Yeah, thanks. I think one of the things that we really celebrate here and one of the values that we hold closely at the department is those people first practices and also thinking through collaboration. So we work closely with different regional providers who support people experiencing homelessness, facing housing insecurity, working to prevent people from ever losing housing in the first place. We know it's so much more expensive to resolve homelessness than it is actually to prevent it. So what are those things we can move upstream? So things like nutrition, access to healthcare, those are strategies that we've really been employing at the department and things that we're seeing a lot of success in. So for instance, our area agency on aging, those are the regional providers across the state working closely with community nonprofits, their county departments to really serve human services from a nutrition through congregate meal sites, through things like Meals on Wheels. So some of those programs that are really successful in delivering services to where people are at and ensuring that they have access to those resources so that you do not experience that crisis later on. And so if we can really push upstream, turn that faucet off, that's a strategy that we know works well. Another one is that we're working closely with our regional continuums of care. So that's a federal program from the U.S. Department of Housing and Urban Development where we bring in federal permanent supportive housing funds to support people experiencing homelessness. And so a lot of those funds, about $40 million annually, goes out to people across the state and really trying to serve either short-term or long-term housing voucher supports along with supportive services. We know that strategy works really well, and it's one that we really need to be identifying and prioritizing this older adult population. So as we advise, as we work collaboratively in those spaces, we want to make sure that all the regions, all the parts of Colorado are being well resourced and we're connecting them. And so one last piece that we're really excited about is the 211 Collaborative, which is a way that we make sure we have real-time resources in communities. So 211 is in partnership with United Ways across Colorado, and through funding with the Department of Human Services, we know if we can get real-time resources, that saves you from that bus ride, that one drive down where you don't have the gas money to get those resources. Giving you those resources that are up to date are critical for this work, and so you're not looking.
That's right.
So in thinking about that, if someone wants to get involved or learn more about this, what are ways to do that, especially through the multi-sector plan on aging?
Well, we are looking for support across all continuums of the multi-sector plan on aging. So if you go to aging.colorado.gov, you can find the multi-sector plan on aging in its full report. You can find our year one strategies and initiatives, and you can find out ways to get involved, likely through the Colorado Commission on Aging subcommittees.